Well, there are a lot of things going on here, Patty. The Rosewood. One of the first things is we're actually closed to any visitors here. We've implemented a very stringent cleaning regime. Several times an hour, all of the doorknobs and surfaces are wiped off with sanitizing solution. Anybody that comes into the facility is required to. Like our residents, they're all required to use sanitizer on their hands, and we're trying to get everybody to practice the social distancing to avoid any spread. And so far things have been pretty good. There've been no signs of anybody being sick here, and we hope to keep it that way. Well, we're doing pretty much the same thing down at the Witter Warmth Shelter. We have a lot more people there. We have. We've had in the high 40s up to 50 people staying there. I mean, you'd think as the weather got a little bit warmer, a little bit nicer, that it would start to drop off. It's not. The shelter is full, and it's looking after a lot of people. Our biggest problem down there has been feeding people, because when the shelter was initially set up, it was set up that food would be provided by all of the social agencies around town that provide meals every day. But because a lot of those programs are run by older people who are, at the most risk of this illness, a lot of those programs have shut down. There's still a couple running, but a lot of them have shut down. So now we're supplying food directly from Rosewood House there every day, and the Salvation Army is supplying bagged lunches for us. So there's a lot of cooperation between agencies here in town, and I think that's something that needs to be noted. We're all kind of in this together. 10 minutes before this interview, I was on a conference call that had all of the shelters here in town: Nova Vita, Salvation Army, ourselves, Penmarvian, Kaori Manor, all of the people that look after large groups of people, and the city were on that call as well. And the level of cooperation and just working together has been great. I'm actually expecting one of those agencies to stop by my door. We're giving them 5 liters of sanitizer, because they're running short, and we have enough to be able to do that. So we're all working together. We're all working very hard to make sure that we keep this disease away. Now, if we get it, and the mayor has been saying that this crisis is not over yet, and we have to keep vigilant. And if we do get it, there are steps in place that we're going to be taking. We're able to isolate people here within the shelters, people who are at risk. Older people who are immunocompromised, people who may have chronic conditions or lung conditions like COPD. Those people are at far, far greater risk of this illness. And the city has made arrangements for them to stay elsewhere and isolate themselves so that they won't be at risk of catching this, or at least as much as is possible. Well, I think the best thing that the community can do is, first thing to do, go wash your hands right now. Go wash your hands. That will help a lot. Second of all, practice social distancing. Do not come by the shelters. We don't need people moving around. The best thing that people can do right now is to stay away and let us work with the people that we've got and try to keep them as isolated and safe as possible. We've got the resources that we need to feed people, to keep people where they are, and to make sure that they receive proper medical care should they get sick. So the best thing that the community can do is, like I said, go wash your hands.